This is Pat Salber with Health Innovation Media, broadcasting from HiMSS 14 at the Orlando Convention Center. And it's my pleasure to have a return visitor from last year's HiMSS. This is Heather McLarney with DebMed. So, Heather, welcome. And I'm hoping that what you can do is to tell us a little bit about DebMed, and then I understand that you have some new products, and we'd really like to focus on that. So let us know what's going on at DebMed.
Yeah, thank you for having us back. So again, DebMed has a comprehensive hand hygiene compliance solution consisting of both skincare products specifically designed for the healthcare environment, as well as our main focus is on a new electronic hand hygiene monitoring system that automates the manual process of hospitals using direct observation to track their hand hygiene compliance. And what's new this year is that we have expanded the system so that it works not just with the DebMed product line, but with soap and sanitizer dispensers from any manufacturer. So if a hospital has a preference for products and they want to stay with the products that they're familiar with, and that's an option, we can monitor that. We also have a new point of care dispenser that allows us to track hand hygiene compliance at the patient bedside and critical point of care. So we have the same electronics in this dispenser as we do with the wall-mounted dispensers. So it also allows the hand sanitizer to be locked and secured in place at the critical point of care.
So if I got it right, there's electronics in here,
Correct.
And every time I squirt the hand sanitizer, it notes whether I've washed my hands or not. So is it fair to say that this little gizmo is a hand-washing nanny?
In a way, it actually helps to give staff credit for what they're already doing. So it helps to make sure that they're complying with the highest clinical standard for hand hygiene, which our system is based on the World Health Organization's 5 Moments for Hand Hygiene, which also is the same as the CDC guidelines. So in those critical care units where staff have very intensive caregiving needs and they can't necessarily move away from the patient bedside to go to the wall, they have the ability now to track that activity right here at the bedside.
So can you tell us anything about whether this actually works? Do you have any evidence that people are washing their hands more, number one, and number two is, do you have any evidence that if they're washing their hands more using this product, that there's actually less infection?
Yeah, so we have a couple of different outcome studies that we've done with our clients. We've piloted the system as well as done some full implementations now over the last several years. So we have data that we can show units. Sometimes they've increased compliance as much as 32% over just a 6-month time frame.
Pretty impressive.
Yes, thank you. And we also have a large client of ours that we've shown over the last 3 years by them switching from cleaning their hands only before and after patient care to the World Health Organization's 5 Moments, as well as using electronic hand hygiene monitoring in a dedicated hand hygiene program, and that they've reduced their MDRO rate significantly.
MDRO?
Disease-resistant organisms. So basically all the different types of hospital-associated infections. So they've seen a significant 22% and 35% reduction in different areas throughout the hospital of their infection rates.
Well, I congratulate you on this, and it's interesting to be here at the M Health Summit where so much of the technology is actually on the phone, and this is actually in a device that we're all familiar with. So thank you very much, Heather.
I appreciate your time.